Hey, welcome. Today we're going to dive into a connection that you've probably never even thought about. What if a whole bunch of chronic issues, like fatigue, headaches, even high blood pressure, are actually linked to the structure of your mouth and jaw? Let's get right into it. So let's just start with this one big question. What if the real secret to feeling better, to having more energy and sleeping well, wasn't something you could find in a pill bottle? What if it's actually hiding in plain sight, right in your own smile? You know, so many of us walk around feeling just drained. We have these nagging health problems that we just kind of accept as part of life. We chalk it up to stress or getting older, but what if there's something much more specific going on? I mean, think about how common all of these are. That chronic snoring, it's not just an annoying habit. It can be a major red flag. Same thing with that constant daytime fatigue, waking up with headaches, or dealing with jaw pain. These aren't all separate issues. They're usually clues, and they're all pointing to one single underlying problem, a condition where you're not breathing properly when you sleep. Okay, so if those are the clues, what's the real culprit here? Well, it turns out that for millions of people, the problem isn't something you can fix with a prescription. It's actually structural. It comes down to the very foundation of your body, your jaws, and, you guessed it, your airways. So this really shows the two totally different ways you can tackle this. On one hand, you can manage the symptoms. Think of a CPAP machine that forces air past a blockage in your throat. It absolutely works, but it's something you have to do forever. On the other hand, you can actually fix the structure itself, creating a permanent solution that gets rid of the problem at its source. Here's the best way to think about it. Imagine your body is a house. A regular dentist, well, they might repaint the walls or fix the windows, your teeth. But an airway-focused dentist, they're like a structural engineer. They inspect the foundation and the ventilation system. And if your airway is blocked, they don't just stick a big fan in the hallway. No, they actually remodel the structure so that air can flow freely, all on its own. And this whole approach has a name. It's called airway-centered dentistry. It's all based on this really simple but incredibly powerful idea. Your body's structure should allow your airway to be completely open all the time. The science is showing us that how your jaw and face grow has everything to do with whether you're getting enough oxygen, and that affects your total health. Okay, so that's the philosophy. But what does this actually look like in the real world? Let's take a peek at a really unique clinical model from Dr. Seifi that brings this entire idea to life. So her practice is actually 2-in-1, which is pretty cool. You've got StarBrite Dental, a full-service dental office, but every single exam looks at your health through that airway lens. And then right next door is Breath of Life Dental. They call it BOLD, and it's a specialized center focused completely on treating sleep-disordered breathing. The two work together as one big integrated system. The one guiding rule for both places is this: find the anatomical to structural root cause. It's not about chasing symptoms like just treating a headache or filling a tooth. It's about asking why that headache is happening in the first place and looking to the jaw and the airway for the real answer. So the diagnostic process is way more than your typical dental checkup. First, they go through your entire medical history, looking for those clues we talked about. Then, they use special x-rays to physically measure the size of your airway. And finally, they give you a simple monitor to wear at home that tracks your oxygen levels while you sleep. All these steps together create this incredibly clear picture of what's really going on. So once that root cause is finally identified, the treatment starts. And this is where things get really fascinating, because the whole focus is on creating a permanent structural change in your body. The main treatment uses something called a biomimetic oral appliance. Now, don't let the name intimidate you. Biomimetic just means it copies nature. So these custom-made appliances don't force anything. They gently encourage your body's own natural ability to grow, gradually making your jaw and airway wider for good. And here's the crucial part. This isn't just some retainer. This therapy uses a specific FDA-registered medical technology called the Vivo system. We're talking about advanced medical devices that are designed to create real, lasting anatomical change, which means opening up your airway permanently. And that brings us to what might be the most powerful and honestly the most hopeful part of this entire approach. Unlike so many other treatments that you're stuck with for the rest of your life, this one actually has an end date. For most people, the entire treatment process takes about 18 to 24 months. That's it. In less time than it takes to get through some big work projects, the entire structural remodeling is done. So let's look at this comparison one more time because it's so important. A CPAP manages your symptoms, and it makes you dependent on a machine every single night for life. Structural correction, on the other hand, fixes the actual problem by working with your body's own biology. Once the treatment is done, you're independent. You just go to sleep knowing your airway is naturally open and you can breathe the way you were meant to. And this approach is an absolute game changer for kids. By guiding their jaw growth while they're still developing, it's actually possible to prevent issues like sleep apnea and crooked teeth from ever even starting. It's a truly preventative solution. The whole process is really designed as a partnership. It's not about a doctor just telling you what to do. It's really about you and the doctor working together as a team to solve the problem. It makes you an active partner in your own health. So we're going to end right back where we started, with a pretty simple question that really sums this all up. If the problem is rooted in your body's physical structure, doesn't it just make sense that the real lasting solution has to be fixing that structure? It's a question that could really change how we think about our health. Thanks for joining us.